So let's now talk about prevention and intervention. So interventions to reduce bullying have really the majority of them have been delivered or developed to be delivered in school settings. There is nice, strong evidence for positive program effects in reducing bullying as well as cyberbullying. The most effective programs tend to involve all members of the school community, staff, students, and parents. What the data also shows is that we need to have both a universal component, or the component that is targeted at all members of a school community, as well as those targeted approaches. So how do we actually manage a situation of bullying when these do occur in our school communities? The review studies, when we start to collate all of these studies together, tend to show that there's actually large variation in that program effectiveness. So some are positive and overwhelmingly positive, whereas others have much more variable effects. And I think really what this speaks to is that there is scope for improvement in prevention and intervention. This was another systematic review of bullying prevention programs. And what they found was that in 2009 to 2016 reported studies, there was a really modest effect size. So when this data is pulled all together, the question becomes, well, how effective are school bullying prevention programs overall? And when we collate all of this evidence together, we can see that the current programs that we have can reduce bullying perpetration by around about 20%, and victimisation experiences by around 15%. But of course, different studies have higher degrees of, scientific rigour, which means that we can only draw conclusions really from the highest level evidence, which are generally randomised controlled trials. I'd like to now sort of speak to really the age-related decline, though, in the efficacy of interventions. What we know is that we have many really strong positive programs, programs that bring about positive effects for our young children, but by the time these young people reach adolescence, their effectiveness drops right off. So this is a meta-analysis of studies that administered the same program. So we're not looking at different programs here, we're looking at the same program that was implemented over the course of a group of young people's whole school life. And what we can see is that by the age of around about 13 or around about grade 8, that effectiveness drops off significantly. There's this really sharp drop, almost to an average of 0. So that's not to say that social and emotional wellbeing programs are not a positive thing. I think they're very much a positive thing, but they may not be actually reducing bullying victimisation as we might think they might be. So this makes us really, again, step back and think about the concept of bullying beyond just that operational definition, and thinking about it as a concept that's really very much embedded within the system in which young people are growing up. So bullying involves a transaction between individuals and their broader environment, their peer groups, their families, their schools, and the broader community. And what underpins this is that an individual is being targeted for a reason. It's not a reason that's their fault at all. That's not what I'm saying. But it's a reason that has been socio-culturally embedded. It's obviously also serving a function for the person that's actually aggressing. It's dynamic. It's an interpersonal process that's maintained by that bullying situation or the information that's being exchanged in that bullying situation. And the process is really overtly or covertly supported by the broader social environment, whether that be among a peer group, family group, or the school community, or even the community at large with regard to our acceptance of bullying behaviour in our communities. So this makes us go back to some of those theories that help us to explain, well, what is aggression and what kind of purpose does it really serve? So resource control theory is a helpful theory for understanding bullying perpetration in particular. And often it's motivated by this perhaps even a subconscious need to be able to successfully access social information, material resources, to achieve that higher status amongst, higher social status amongst a peer group. And in order to gain that resource control, an individual might choose to adopt either coercive strategies or proactive resource control strategies to achieve that higher social status. So coercive strategies, this is strategies that use force and without the regard for others, whereas of course pro-social strategies are about collaboration and cooperation with others. What we know is that aggression, or the use of aggression, is most effective when it's used in combination with pro-social strategies. So when pro-social and coercive strategies are used together, this tends to have the greatest effect. So these young people generally are much more socially skilled, they're highly popular amongst their peer groups, they have pretty average adjustment outcomes, they achieve the highest level of social dominance amongst their peers, and those pro-social strategies are actually used to reconcile the aggressive action that they might have engaged in after that dominance is first established. Whereas the use of coercive strategies only often really falls short of being able to access those resources. So young people who are engaging in coercive strategies only, they generally present with more internalizing and externalizing problems. They generally have more developmental deficits than their peers, same age peers. And the aggression is usually impulsive and overreactive. And because of this, they often become socially marginalised, and it's an unsuccessful attempt to raise that social status, unfortunately. So this really starts to explain that the perpetration of bullying behaviour really is not a one-size-fits-all or a one-size-explains-all thing. This is some data from the US in which bullying perpetration was measured over time. So in this study, young people were recruited in grade 6 and they were followed through to grade 10. And what we can see is that there are different trajectories of bullying perpetration. And what this study was able to conclude was that bullying, victimisation, impulsivity and depression was what predicted increases in bullying perpetration over time. What actually predicted decreases? Empathy. Students that were exposed to the social emotional learning program were also much less likely to be amongst the group that were in the more sort of serious trajectories of bullying perpetration. So I think this study really again speaks to the heterogeneity of bullying perpetration behaviours. This was some data that was examined by our colleagues over in Western Australia. And this study really wanted to understand, well, what are the differences between those who might perpetrate bullying by itself, whereas those compared to those young people who experience both victimisation and do aggress against their peers. And what this study really was able to conclude is that it's not about poor self-control for those who are engaged in victim perpetration, but it's also likely that there are some motivations that also really perpetuate the problem of difficult relations with peers. So this study really found that those motivations, recreation, reward, rage or revenge, they were actually associated with that victim perpetration group overall. So they tend to have a much more aggressive motives compared to those who are perpetrating bullying alone. So it comes back to really some of those fundamental things around how young people actually attribute other people's behaviour towards them. So we really need to do a much better job of really understanding this crossover group, or those that are engaged in both victimisation and perpetration. This was a qualitative study, so a qualitative study is one that involves interviews or focus groups in order to explore the developmental process of bullying, victimisation and perpetration experiences from the perspectives of both students and teachers. And what this particular study found was that there is actually these sort of three phases. So there's this single role phase, which comes first. So most young people who were eventually engaged in both victimisation and perpetration were initially victimised by their peers themselves. Those that engaged in victim perpetration continually tend to attack more vulnerable targets or retaliate against those that are perpetrating against them. And so their victimisation tends to continue. The third phase is really sometimes when it reverses or it terminates that dual role, and that's when young people are able to really create a greater empathic understanding of the situation and another person's point of view, and when there's positive interventions from peers and adults, that's when the bullying tends to cease. So again, I think it really speaks to some of those underlying factors that explain behaviour. And what we know is that the cognitive or the thought processes, the emotional processes and the moral processes work conjointly to organise and guide social behaviour. So maybe that's where we need to be starting to think about our interventions for adolescents one-on-one. What we know is that low empathy, low effective empathy is associated with bullying perpetration against peers, and that moral disengagement is also associated with bullying perpetration. So moral disengagement is when there is a disconnect between your beliefs and your actions. And when there's this moral disengagement, we often engage in other strategies to try and neutralise that awful affective feeling that we have when we might be engaging in something that is morally undesirable. So young people might then go through this process of displacing responsibility, of minimising their behaviour against others. They could perhaps ignore or misconstrue the negative consequences on the person that they're aggressing towards. They might dehumanise them, or they might blame. So these processes at a cognitive level really help to neutralise that moral disengagement. And this is the difficulty with those that do aggress against their peers, is that they can often recognise harmful intent when it's directed at them, but they don't so much consider the harmful intent of their behaviour when it's directed towards others. So what's the role of schools and teachers? Well, we know that there is a range of factors associated with bullying. I'm sure you're all very well aware of all of these factors, but we know that poor supervision practices or ineffective responses to bullying by teachers is often related to high rates of bullying victimisation. Physical settings that facilitate bullying, policies that discourage effective responses to bullying when it occurs, lower student connectedness to school, and negative perceptions of school are associated with higher levels of bullying victimisation in particular. So let's then start to think of, well, what's the actual reverse of that, and can we concentrate our strategies on being able to target the opposite to that? In the purple box there, this really describes some other work from that came out of the US, and the really striking finding here was that regardless of bullying involvement, teacher-student relationships were the most important thing for young people, particularly those that were engaged in both victimisation and perpetration against peers. And that strong adult relationships within the school environment in particular was protective against depressive symptoms, against emotion dysregulation and behavioural problems. So it really comes back to the modelling of and engagement of teachers and adults in being able to promote healthy, respectful relationships. Of course, we know that behavioural patterns are often also the result of mutual influences within a family context, and we know that aggression can become a viable coping mechanism based on positive reinforcement and modelling. So bullying between siblings obviously increases the risk of being involved in bullying in a school environment or with peers. We also know that ineffective parenting behaviour can also be associated with greater involvement in bullying. So we're talking about, well, what's the kind of conflict resolution style even of a family, and how much does that actually contribute to the risk of further bullying, victimisation or engagement in bullying. The research really tends to show that family components incorporated into those whole of school or universal interventions are very helpful, and parent training can actually be quite key to reducing bullying. So what then is the role of parents? So positive parenting behaviours are really protective against bullying, victimisation. Really strong child-parent communication is important. Warm, affectionate relationships are important, even into adolescence. Parental involvement and support of the young person and their well-being is obviously important, as well as general supervision. Interventions that involve parents are more effective in reducing bullying compared to those that don't involve parents. So the following strategies have been shown to assist in reducing bullying, and schools can also help to play a part in being able to bring this to fruition. So helping any strategies that can help increase parents' knowledge about bullying, increase their confidence to talk with their children about bullying or mental health or any sort of peer relationships is important. Confidence to help their child respond to bullying effectively if they encounter it, and knowledge of what the school is doing to address bullying can often also be quite helpful. So how do we enhance efforts to reduce bullying? Well, really it comes back to cultivating norms that promote diversity and inclusion together with those anti-bullying norms is likely to strengthen bullying prevention, especially with our older children and adolescents. Students in positive school climates, they report experiencing fewer physical, emotional and cyberbullying behaviours, and they generally have greater connectedness, greater peer attachment, assertiveness and empathy towards others. So these are all those social emotional skills that many programs really try to strengthen. What we know is that the greater levels of empathy that students report, the more likely they are to report being bullied if they are bullied. And really, young people are more likely to defend victims of bullying when adolescents also have greater empathy and when there's some kind of classroom level pro-social norms around interactions and respectful relationships. So future directions and summary points. Look, enhancing perhaps the family-based component of bullying intervention is likely going to be beneficial. That's really an under-researched area at this point in time, and that's something that we'd like to see further strengthened alongside school-based intervention. We also really need to enhance those targeted approaches to bullying, to managing bullying situations when they do occur, and really recognise the heterogeneity in the perpetration of aggression towards other peers. That's what's likely to help strengthen school-based interventions. And I think also we need to develop a stronger model of how best to intervene with our adolescent populations, given that really sharp decline in our programs for being able to reduce bullying specifically. So some conclusions and take-home messages today. We know that cyberbullying is part of the larger problem of bullying among youth. So efforts to address bullying should really target both face-to-face forms of bullying and cyberbullying, not just cyberbullying alone or traditional bullying alone. Schools are a really key setting for implementing interventions, and there's already some fantastic work that's done in schools. I think a key focus really needs to be around mobilising the uptake of really evidence-based approaches towards strategies for managing bullying. Involving parents is really critical to the success of efforts to reduce bullying. and making it a whole of school community responsibility to be able to manage our relationships with our peers, but also between parents and schools. So really any efforts that engage parents effectively to play an active role in the school community is going to be helpful in being able to address bullying at large. Measuring bullying using standardised questions is critical to assessing change, and those measurement models need to be attuned to the response period in which young people are reporting on. Young people find it easy and acceptable to reflect on their experiences, and they generally have a pretty strong validity, these measurement models. In terms of intervention strategies, they need to be age appropriate, and they should really have both a universal and a targeted component. And I'm thinking that really that the targeted component is where our focus might be, at least in this sort of next phase of being able to translate the research into practice. Strategies should also directly address the perpetration of bullying. Motivational interviewing or one-on-one counselling can help to get young people to reflect on their own behaviour when it's done in a non-threatening way, and can help them to further develop their own social emotional skills to be able to use more pro-social skills and being able to connect with their peer group. Reducing bullying, I come back to my original point today, will likely prevent cases of depression, anxiety, self-harm, and even suicide behaviour. So investment in evidence-based interventions that reduce bullying really should be viewed as a strategy around being able to prevent serious mental illness from developing. And finally, community education can really help shift cultural norms and shift cultural change about the tolerance of bullying behaviour. So public health campaigns that deliver a message of community-wide responsibility and action should really continue and should really be strengthened from here on in. So thank you so much for your attention this morning. I'd like to conclude there by also acknowledging the amazing research team that also helps to bring all of this research to fruition. So just a shout out there to all of my colleagues back at my home institution.